Welcome back to the Science of Golf Performance. I'm Alex. Today I'm going to be talking about low back pain, why we have it, why a lot of golfers have it, it's very common, what we can do to get rid of it. Before we start, make sure you give a like, comment, subscribe to the channel. Really helps us out, helps us reach more golfers out there. So, talking about low back pain, probably the most common area that I see. That most of us see here at Perfect Success with our clients, people coming in, and most of the time actually pretty easy fix. A lot of people want to go the route of getting an MRI or getting an X-ray, checking it out because they think it's something like skeletal or joint based. But you want to make sure that you first assess yourself. So check the home assessment in the link below. This will help us get kind of a baseline of where you are. The number one reason that people have low back pain is going to be because there's a lack of mobility in the hips. So we really want to check that first. Okay, if you lack the internal rotation of your hips, the other things are going to be compensated, and your low back is going to be one of those things. So there are 3 common swing faults, and you probably will recognize them as I list them off. You'll probably have 1, maybe 2, maybe 3 of them. So the first one I want to talk about is excessive sway. So excessive sway in your swing is going to be, your typical golfer who you're swaying through the ball, you're not getting rotation really in your swing, you're just kind of gliding side to side. A lot of people will go to a golf instructor who will try and fix their technique with this, which can be done. But if you're lacking the mobility in your hips, that's something that your body's just going to ultimately want to do naturally. So to do that, you're going to have to make some compensations in your swing. If I lack hip mobility and I'm trying to rotate, except I'm swaying, but I try and rotate, then I'm going to have to use my low back. I'm going to use some muscles in my low back that I don't really want to, and I might pay for that later. Okay, so lack of hip mobility will cause a excessive sway in the swing. So 1, my technique is compromised, and then 2, if I try and fix it without actually addressing the real issue, it's going to cause long-term problems. So excessive sway is number 1. Now, number 2 is going to be early extension, which another one that probably a lot of you have heard of. So this is when I'm extending my hips too early in the swing. Instead of getting up into my lead leg and the finish of the swing, my hips come forward maybe here or maybe before impact. So this is huge, and we've done a lot of videos on this. Again, if you lack hip mobility, that's one of the compensations that your body's going to have to make. So again, get those hips assessed. Early extension, excessive sway are 2 things that are going to do that. Number 3 is going to be just poor utilization of the ground overall. Basically, you'll be upper body dominant. If you're lacking hip mobility, you're going to be making poor use of the ground, or not as good use of the ground as you could with proper hip mobility. So with that, I'm going to be just using my upper body coming through the swing, not a lot of my lower body, so that again, my low back is kind of doing a lot of that work here. So why am I going through all these, right? I'm kind of poor hip mobility, because we want to keep you healthy, playing long for the rest of your life without pain. And if you have any of these 3 swing faults, then the first thing you need to do is get your mobility checked, specifically your hip mobility. Because if you do not, and you have these, your low back, maybe not now it hurts, maybe you feel great, but down the line, it may start to kind of backfire on you. Okay. So what can we do if we do have any of these 3 swing faults, and I've assessed my hips and I'm lacking internal rotation, especially on my lead leg, because we know that's the most important when it comes to my low back pain. If you guys grab a lacrosse ball, softball, you can use a foam roller for these. I would definitely require one of these, especially for working the hips. So if I look at this angle over here, what you want to do, we're going to target the glute med first. So a lot of that low back pain that you get is actually going to come from your glutes and not so much your low back. So take a ball, harder the better here. If I put my hand on my low back, just stick your lacrosse ball in that area there. Okay. All right, so from this angle on the floor, this is how you're going to find your glute med. When you're sitting, knees up, I'm going to put my hand on my low back, right around where you feel that pain, and then take your lacrosse ball, you're going to stick it right there and lean back, so you're putting some good pressure on the area. Now you can move it around a little bit, try and find where the tough, achy, or sore spots are. Okay, you want to find that area and pin that ball down pretty good. If you feel like a burning sensation, you found the area and you want to stay there, continue to put pressure. After a little while, I can go ahead and do some movement. So I'm going to take my bottom leg and bring it up and down like so. Okay, you should feel that muscle moving in there where the ball is. Should not feel completely pleasant, but you want to continue to work that out for maybe around a minute or until you feel things start to get a little lesser on the pain side. Maybe you'll feel some twitching that goes in and out, or maybe that burning will start to go away. So that's the first way to do it. Okay. Now, you can use a foam roller as well if you have this tool here. It won't get as deep, but same thing. So you can sit on top of that foam roller. What I'm going to do with this one is put my ankle across my knee and then kind of roll on that side low back, same area I did with the lacrosse ball. Now, the second area I want to address for lack of hip mobility and for back pain is going to be your TFL. Okay. This is a muscle, it's a hip flexor that's going to highly assist with your internal rotation and indirectly kind of have any low back pain you have may be a very big contributor to that. So I'm going to take my lacrosse ball again. With this one, I'm going to find my pocket. So it's a little more to the front than your glute med. And I'm going to stick that lacrosse ball a little to the side of my pocket. Okay, if you've ever heard of the IT band, which runs up and down the leg here, your TFL is kind of like the cousin to the IT band. So you're going to be around that same area, but higher. Now I'm going to go to my side again. I'm a little more on my side this time. Okay, I'm actually going to bend my lower leg, if you can see that there. Top leg stays straight. Same thing, I'm searching for the sore, achy spots, the burning spots. My bottom leg, I'm going to start to bring that up and down like this. Okay, so stay on that spot. Doesn't feel very pleasant. You might start to sweat. The leg goes up and down until you feel it start to go away, get a little lesser pain here, okay? So after you've tried hitting those two muscles on the floor, you stand up, do a little movement with your hips. You can kind of hike your knee up, go around, kind of loosen them up a little bit, little blood flow there. And if you want to really get into some good hip mobility, check out our virtual program with the link below. A lot of our coaches are very creative when it comes to hip mobility drills and getting you to move better after those soft tissue movements. So the glute, the TFL, what we just hit, two major contributors to hip movement, which are going to contribute to the low back staying healthy. Again, if you have either one of those three swing faults, excessive sway, poor lower body utilization, so you're very upper body dominant, or poor early extension, make sure you check your hip mobility. The link is below, check that on a home assessment. If you are lacking it, you are at risk for low back pain in the near future or in the far future. But very important to get that checked if you want to become a better golfer, if you want to stay pain-free. These are things that need to be assessed, tested, and then you need to have a plan of action for. Okay. Thanks for checking out the video today, guys. Make sure to like, comment, subscribe to the channel, and we'll see you in the next one.